So I'm going to bring this closer so you guys can see me. And I'm just getting ready. Okay. And okay. All right. Okay. I think I mastered this. And we are live. And I'm so excited. So good evening, good morning, good night, wherever you are. And this is going to be a super, super exciting show for me, because this is going to be a show where I'm talking about real issues, real problems for women, in particular for women that have darker pigmented skin, whether it be dark pigmented, melanin-rich skin, whether it be Hispanic, whether it be Mediterranean, whether it be Indian, whatever the color of the skin is, whatever the shade of the skin is, as long as it is darker than white, this is the show for you, because today we are going to address issues that unfortunately people do not address in the United States, nor do they address them in institutions such as mine. So first of all, let me start with introducing myself. My name is Eva, and I am the owner of two clinics. I have a clinic in Miami Beach in Bay Harbor for the last 40 years, and I have a second clinic in a suburb of Atlanta in Newnan. I specialize in hormonal imbalances. I specialize in skin that suffers from PCOS, endometriosis, Cushing's disease, Hashimoto disease, insulin resistance, which indeed then gives you the problem of Jemiah High, which then indeed gives you the problem of unwanted hair and discoloration, Angela Gang High, and discoloration. And as this is a huge problem in America, and I am probably the number one dark skin expert in the United States. I came to America 40 years ago, and I already came with my expertise and my knowledge in treating dark and black skin. And as such, I have a clinic in Bay Harbor in Miami Beach for 40 years. And 10 years ago, I opened a clinic in a suburb of Atlanta in Newnan. And the reason that I am coming today to talk to you on Whatnot, on this platform, and I'm on other social media, but today we are talking straight to Whatnot, is because I believe that every woman, wherever you are in the world, deserves to know that there is a choice, and that there are options that you can take when it comes to problems that you have with your skin. PCOS is today amongst the top conditions that women suffer from, polycystic ovarian syndrome. And it is not only, hi guys, hi. It is not only, that, okay, I have PCOS, I have polycystic cyst and syndrome, and this is why we are going to address it now. No. The problem is so much deeper, and I am talking to you from my heart and from my experience. And unfortunately, as the number one skincare expert in the United States for dark pigmented skin, I am probably the number one expert when it comes to PCOS, endometriosis. And I'll tell you why. Unfortunately, I have one daughter, and my daughter suffered from age 14, started with PCOS, then graduated to stage 4 endometriosis. For 32 years, my daughter underwent 19 surgeries. 19 surgeries. When PCOS started, my daughter was hairy from her forehead all the way down to her toes. That was number one. My daughter started to gain weight, and it had nothing to do with her diet. It was all related to the hormones. My daughter suffered from the most excruciating periods, from the most excruciating pain, debilitating pain. And my daughter underwent, in the process of 32 years, 19 surgeries. The last surgery was 2 months ago. 2 months ago, my daughter had her 19th surgery. My daughter had stage 4 endometriosis. My daughter lost more than 70% of her organs due to the disease. And this is why I'm telling you that I'm coming to you not only as somebody that runs clinics and I treat people and I make products, but I come to you because it is a very personal, a very deep, painful condition that my daughter suffered from. Obviously, my daughter could never have any children because when you have PCOS and then you graduate to stage 4 endometriosis, there is no way that you can have children. So she was robbed of that. She was robbed of her life because for 32 years she suffered from pain day in, day out, day in, day out. And women in America are disregarded by majority of healthcare professionals when it comes to pain. The answers that you get is, have children, it will go away, or okay, take some tablets and it will go away. And the reality of it is that PCOS, endometriosis, Cushing's disease, insulin resistance, diabetes, thyroid condition, these are not conditions that will just go away because you will take some tablets and it will go away. They are all related to our hormones. They are all related to our reproductive organs and our hormones. And if our hormones are off, and this is where the problem starts, then everything else is off. So when I come to talk to you, I talk to you because I think that God put me on this planet, I guess, because I have no other explanation why me, why my child, why my only child. I have no explanation except that I am in the profession, that I understand the profession, that I'm not shy, that I have the ability to talk, and I talk and I educate women. So I have a YouTube channel, and I'm on my YouTube channel, and I talk on my YouTube channel for many, many years. And I provide a lot of information. However, I feel that there are outlets, such as Whatnot, where a lot of people and a lot of young people and a young woman come into, and because people are searching, people are looking to buy stuff. And because that's what Whatnot is. It's an application where you buy stuff. And when I looked at the application, I could see that there's so much stuff that's being sold, and women are searching for something to solve their problem, to solve their discoloration problem, solve their problem. And there are all kinds of people selling all kinds of stuff, and it's not right, and it's not correct. So I decided that I'm going to be talking, I'm going to be educating, I'm going to be providing information to every woman out there that suffers from discoloration, that suffers from PCOS, that suffers from Cushing's disease, that suffers from insulin-resistant Deb Mackay, that suffers from diabetes, that suffers from Cushing's disease. I am going and I'm talking to you, and I'm going to explain you, and I'm going to teach you, and I'm going to tell you what works and what doesn't work. Because not enough, my dear ladies, not enough that, in this case, my daughter, but thousands of patients that I have over 40 years that comes through my doors. Not enough that you suffer from pain, and you suffer from excruciating pain. Not enough that that's debilitating. Not enough that you are gaining weight, and you only have to look at food to gain weight. And the doctors tell you, go do a diet. You lose weight, your endometriosis will go away. Your PCOS will go away. It's because you are fat. And and that is the farthest things from the truth. And so you cannot lose weight when you have PCOS or endometriosis because you have insulin resistance. And your own insulin works against you. So no matter what, you cannot lose weight. The weight, you will never lose, never lose the weight. So the point of the story is this. When you seriously suffer from PCOS and from endometriosis, you have unwanted hair, you gain weight, you get discoloration, and it's a very vicious, very vicious cycle that that you go through. And again, I'm just speaking from my personal experience as a mother. So when you go through these stages, you gain weight, you can't lose weight. Misery likes company. And when you have unwanted hair, and already you feel like you're a man because you're growing hair everywhere where you shouldn't grow hair. Then you're gaining weight. Then you're trying to tweeze the hair, and then after you're tweezing the hair, you actually creating more discoloration because you are creating more inflammation. So this is something that people have to know. Let me just say, see, okay. All right. Okay, so I'm sorry. I just had to see what people are saying. If there's anything that I have to answer. So what we are talking about today? Today, I want to address your discoloration, and I want to say a few things about discoloration. A lot of young women that have a darker pigmented skin do not know that there are solutions, that there are real solutions. What happens in America, there's a lot of people that are selling, products, they are selling bleaching products, and the bleaching industry is, I think, $7 billion today in the world, because everybody wants to change their skin color. Nobody is happy with what they have, and everybody wants to get rid of the discoloration that they have. Unfortunately, there is also a situation where people think that there are quick fixes like this, that you can quickly fix a problem. And you cannot fix a problem that is caused due to inflammation and due to hormonal imbalance. So what is happening to a woman that suffers from hormonal imbalance that has unwanted hair? So the first stage that woman goes through is you are growing hair. So now you're growing hair, you don't know what to do. So you are tweezing the hair. Well, when you are tweezing the hair, you are pinching the skin. When you are pinching the skin, you're getting discoloration. Why? Because when you pinch the skin with a tweezer, you are actually stimulating more melanocyte, more melanin. Why? Because when you pinch the skin, there's an inflammation immediately. And what is melanin in the human body? I will show it to you so you get an understanding. This is your hair. This is your skin out. This brown thing, that's the melanin. So see how close to the surface of the skin it is. So when you pull a hair out with a tweezer, you pull a hair out and you pinch the skin here, melanin immediately responds. And the way that this happens is when there is irritation on the skin, from whether it be from a tweezer, or whether it be from waxing, or whether it be from threading, what actually happens is when there is irritation, immediately the melanin in the body reacts and it tries to protect your skin, just so everybody understands. Melanin is a protective mechanism of the human body. It protects our skin. And therefore, melanin pushes to the surface. So if you have darker pigmented skin, you have more melanin. If you are lighter like myself, you have less melanin. So if I pinch my skin will get inflamed, irritated, but it will get red. If you, as a black or dark person, pinch your skin, or Indian or Mediterranean, whatever it be, that have pigment in the skin, the pigment will be darker. And so then you are creating discoloration because now you're getting marks because you are tweezing the hair. And when you are tweezing the hair, it's not you go and then you are feeling with your hand. And when you feel with your hand, then you want to get that sucker that you feel, and then you will go and dig with the tweezer until you get it. And once you get it, then you created already a wound. You broke the skin, and there's going to be discoloration. So this is a really vicious cycle for women that suffer from PCOS and hormonal imbalance and endometriosis and insulin resistance and Cushing's disease. So you get discoloration. The discoloration is created by your own doing, but you don't know that you are creating it because you are tweezing it. The second thing that people very often do, they go waxing. And my hair stands up when I see melanated skin, and then people, whoever, they put the wax on the skin and say, oh, and they pull and yank the wax, and they show you on screen how wonderful the wax yanked the hair out. Now, ladies, I have a question to ask you, and this is something that's very important. Any of you, because I know it happens every single day, because I can see it every single day. Any woman, black or white, Hispanic, Mediterranean, Indian, makes no difference. If you wax your upper lip and you wax it on an ongoing basis, every single person that has melanin in their skin will have a dark shadow on the upper lip. Will have a dark shadow. Why do you think that happens? It happens because when you are waxing the hair and you are yanking it, you are creating an inflammatory reaction. Melanocytes react, they try to protect the skin, and they push more color to the surface. The more you do it, the worse it gets. So waxing, threading, tweezing are the three things that should never touch your face, particularly if you have melanin in your skin, if your skin is darker. You should never tweeze, you should never wax, and you should never thread, because all three will create discoloration. Now, what is one to do when one did that already, and now you have discoloration? What is one to do? Well, there is a solution, and this is why I am here today. And the solution is, I'm sorry, I can't see without glasses, so let me see somebody. Jenna Gap, hi. Whoever joined, and Maya, how, hi. Charlie, hi. I apologize if I'm not saying everybody hello, because I'm not seeing everybody and I have to put glasses on. So, in any case, so what is one to do if you indeed already got discoloration? So, a dark person with a lot of melanin in the skin will get discoloration even from a mosquito bite. Every black woman knows that the mosquito bites you and it will leave a dark mark where the poison of the mosquito bite went in. Why? Because when the mosquito bit you, it created immediately inflammation. What does inflammation do in the human body? It stimulates melanocytes, it stimulates color. So it pushes color to the surface wherever. If a mosquito bites me, it will be red. If a darker person gets bitten, it will be darker than their own skin. Why? Also why? Because melanin is not a calibrated machine that knows exactly what shade of brown, black, light brown, medium brown your skin is. It just pushes color to protect you, because that's what it's the job of melanin, is to protect the human skin. So it pushes, and it will always be darker than your own skin. So now what is a person to do that has already discoloration because they pluck, because they thread, because they wax, because they abuse their skin? What is one to do? What is one to do that has discoloration under their armpits? What is one to do that has discoloration on the inner thighs? Because the inner thighs are chafing and rubbing one another. What is one to do that has ingrown hair on the bikini line or on the pubis? What is one to do that has dark knuckles or dark elbows or dark ankles? Well, there is a solution. But please, I want to say this up front. It's not a quick solution, but it's a solution that works. The solution works 100%. How do I know? Because I created that solution. As a skincare expert, and as an expert that has the expertise in hormonal imbalances and discoloration, it took me many years to create something that would be suitable for all skin colors, that would not destroy the pigment of your skin. And this is it. This is it. Now, this is what we are going to talk about. And I just want to share with you, let me just, I don't know if I have to write this. I want to share with you that I have a surprise today. And I have a surprise. So anybody that will purchase one of my kits, right now we are talking about the Mini Eva Skin Lightening Kit for the face. You will get a gift, and I will tell you later what the surprise is to the gift that you are going to get. You're also going to get, if you get the Mini Eva Skin Lightening Kit for the face, or the Mini Eva Skin Lightening Kit for your body, and you order the kit today whilst I am live, not only will you get a gift, you will also get a 15 minutes live consultation with me. So wherever you are, we schedule a live consultation. My number is 305-864-3333, 305-864-3333, and we will speak and we will schedule a live consultation. If indeed you have an issue and you are uncomfortable to ask publicly, then you can ask me and we can talk, and I can look at you. You know, we can schedule this through a application, perhaps through WhatsApp, so I can look at the skin, and then we can take it from there. I usually charge $49 for a consultation for 15 minutes, but for tonight, to show good faith, because on Whatnot, on your platform, very few people know me. On YouTube, on Instagram, people know me because YouTube is my home. So this is not new, but for you, for Whatnot, this is new. I'm here. I'm very new, but as I said, there's a reason for it. So today we are talking. The first item that we are talking about is the Mini Eva Skin Lightening Kit, and so what this kit is doing. This is a professional kit. This is not something that you can buy anyway. You cannot buy it anywhere, not in a drugstore, not at Saks Fifth Avenue, nowhere. You can only buy it here on Whatnot, or you can buy it in my clinics. So I have a clinic in Miami Beach, in Bay Harbor, for 40 years, where I am right now. And I have a second clinic in a suburb of Atlanta in Noonan. So you can only get it if you come, or you get it here on Whatnot. Now, this is a kit. The Mini Eva Skin Lightening Kit is made out of mandelic acid. And I don't want to bore you, but I want to give you as many tools so that you can make your own decision, and it has to be logical to you. I am going to explain you why this kit is the only kit that is suitable for all skin colors and will not destroy the pigment of your skin. And please bear with me, because this is very important, and I promise you that there is not one human being out there on social media that will take the time to explain you the difference, because 99.9% none of them know. I know because I make it. Because I make in my lab these products. And I came to create these products from try and error, because I am here 40 years. So I don't know how much you can see, but that's my clinic. So I am here for 40 years. And for 40 years, I treat human skin, and people come to see me every single day. People come to see me because they have issues, whether they're hormonal issues, they're menopausal issues, they're unwanted hair, they're discoloration, whatever the condition is. I, as the #1 skincare expert that specializes in hormonal imbalances and specializes in discoloration, it took me 27 years to create the Mini Eva Skin Lightening Kit that is made out of mandelic acid. And why does that play a role, and why this is different than any other kit, any other product that you find on the market? I'll tell you why. 32 years ago, I created the first glycolic acid products, Let me just show you something so you understand. Okay. This was 32 years ago. This was my product. So I created glycolic acid products for discoloration. And my products sold all over Europe. I exported them to hospital, pharmacies, a medical clinic, cosmetic clinic, cosmetology clinic, and dermatological clinics. I created a lightening treatment, so for professionals, so for doctors, and so for home use for people. But glycolic acid could not be used on darker pigmented skin. And why is that? Because darker pigmented skin is very delicate, very sensitive. And glycolic acid is in a molecular structure that when you apply glycolic acid on the skin, it penetrates very, very quickly under the top layer of the skin. Let me show you something. So when you apply glycolic acid here, it goes very fast down here, very, very fast. So it goes through the top layers of the skin, and then it reaches here. You see the brown thing? That's the melanin. So it goes very fast, and it reaches the melanin. If you apply glycolic acid on a white person like myself, no problem if you know what you're doing. No problem. Because even if the glycolic acid was too strong, the melanin actually in my skin won't be as strong, and my skin will maybe get burned, my skin will get red, my skin will get brownish a little bit. However, it will go back to the normal color that I have after a while. But when you take glycolic acid and you apply it on darker pigmented skin, you have no control. And the same way that it goes through white skin, it goes through dark skin, it goes in very, very fast. And guess what happens when glycolic acid goes in? Immediately stimulates melanocytes, immediately stimulates melanin, and you will use glycolic acid for 2 weeks, and it will look fantastic. And after 2 weeks, the glycolic acid suddenly will subside, and discoloration and burning and patches and blotches on your skin will come out because the glycolic acid was too harsh and stimulated your melanin and your melanocyte. So on dark pigmented skin, you can never use glycolic acid. This is why this kit, the Mini Eva Skin Lightening Kit, and I think you guys can see it. So I think you can see it. So when we are talking about lightening discoloration, and if you have pigment in your skin, if you are Hispanic, if you are ethnic, if you are Mediterranean, if you are Middle Eastern, if you are African, whatever, you have melanin in your skin. The only product that is safe to use, in parentheses, if you use it according to the instructions that come with the product, then you use the mandelic acid treatment. Why? Because the mandelic acid's molecular structure is much bigger than the glycolic acid, much bigger. And when you apply the mandelic acid on your skin, it will take a real while for it to penetrate because it's very big. And the bigger a product is, the size of the product is, the harder time it has to penetrate into the skin. So I created a kit, and now I'm going to explain you what the kit does And I'm going to move this perhaps like this, and maybe I have to do this a little bit lower. Excuse me just a second. Maybe you can see it like this, and I can see you fine. Okay, I'm going to explain you how this process works and how this product works, and why this kit costs $235, and it's suitable for the face. So up to here, from here to here, that's where it's suitable from. I have a second kit that is from here down for the body. We'll talk about that later. But right now, you have to your right, you have the kit. I pinned the kit in. So anybody that's interested in the kit, you can buy the kit now. Here is how the kit works and what the items are in the kit. So the items that are in the kit consist of six items. So what are they? The first thing that we have is crystal microdermabrasion scrub. So the crystal microdermabrasion scrub is the first thing that you're using on the skin. The second thing that we have is the microneedle roller, The third thing that we have is the mandelic acid. The fourth thing that we have is the neutralizer. The fifth thing that we have is the HA plus C serum. And the sixth thing that we have is the HA plus C cream. Now, why do you need all 6 items to treat your discoloration? I'll tell you why you need them. And I'll tell you how I came about to create these 6 items. If you come to my clinic, and if you come for treatments, and hundreds and thousands of women over the years come for treatments, be it laser hair removal, be it discoloration, be it acne, be it problems with the skin, be it hormonal imbalance, whatever the condition of the skin is, I treat your skin. In order for me to treat discoloration on darker pigmented skin, I have to go through a process. The process in the clinic is I do crystal microdermabrasion. I have a piece of equipment, I have a machine, and that machine abrades the skin. This is a machine that I brought from Italy, and this machine will abrade the skin. Well, in order for you to have the same process, I created from the same crystals that I use in my crystal microdermabrasion machine, I created this microdermabrasion scrub. So it has exactly the same crystals. What is so special about it? So the crystals are applied on the skin. So you make your skin wet. Then you take the crystals, they look like this. You take a little bit, like a pinch of salt, and on wet skin, you apply a little bit, like a pinch. You apply a little bit of the crystals all over your face. And now you start scrubbing. What you are achieving is you are achieving the removal of anything that's in your pores. So it removes, because the crystals is a mineral and it's very hard, it doesn't dissolve. So it goes inside the pores, like if you have blackheads, whatever you have pores, and it takes out the sebum, the dust, what's on the surface of the skin, and it also removes the top layer of the skin. Now, why is that important? Ilona Rom, hi Ilona, hi, and Platinum, hi, Isabella. Okay, and so I don't know who I'm missing here, guys, excuse me, but fine. And so the first thing, if you are in the clinic, I will do mechanical crystal microdermabrasion. Well, we created a crystal microdermabrasion that you can use as the first step when you're doing this treatment at home. Now, remember that I said that when you use glycolic acid for darker pigmented skin, glycolic acid is not suitable because it penetrates very fast. And I told you that mandelic acid, by the way, that's derived from almonds. The mandelic acid is a product that the molecular structure of it is big. So when you lay it on the skin, unless you prepare the skin exactly the steps that I'm giving you here, it will not penetrate into the skin and you will not see the desired results. So we are braiding the skin, that's the first thing. Then we take the microneedle roller. We take the microneedle roller and we roll with the microneedle roller in every direction. We roll all over the face wherever you have discoloration. And if you have discoloration, let's say here, then on the areas of discoloration, you roll a little bit longer, but you roll your whole face and you roll your whole neck. Why? Because the roller, the microneedle roller, creates little perforations in the skin. In my clinic, I use a mechanical microneedling. So I do mechanical crystal microdermabrasion, then I do mechanical microneedling. So this is exactly the same way that I do in the clinic. I created, that's why we call it a mini Eva skin lightening kit, because it's a mini me in your house. So I recreated this with the best of my ability, as close as possible to you coming to the clinic and getting the treatment. So you have crystal microdermabrasion, then you have microneedle roller. So that's number 2. Now, after microneedle roller and after crystal microdermabrasion, now we are coming to the boom, boom, boom part. Now we are going to apply the mandelic acid. But before we apply the mandelic acid, we are going to prepare a neutralizing solution. Why? This is a real product. This is a real product. This is not a make-believe product. And this product has to be neutralized. After you put it on your skin, after 3 minutes, then 4 minutes, and so forth, it comes with instructions. This product has to be neutralized. You cannot leave the product on. I wholeheartedly say absolutely not. I apply it in the clinic the same way. So what you do is, this is powder. So this is powder. So this is neutralizing powder. So you take a little bit of like a pinch of salt in a little bowl, and you put just a little bowl, and you put like a quarter glass of water. In the bowl, you put a pinch of this, like a pinch of salt, like a quarter teaspoonful of the neutralizing powder in the bowl, mix it, and you put a cotton ball inside. And you put this neutralizing solution to the side, wherever you are doing the treatment. And now you're going to take the mandelic acid. I recommend wholeheartedly that you take a Q-tip and you don't do it with cotton. And I'll tell you why. If I was a scrupulous businesswoman, I would tell you, take a cotton ball and put the mandelic acid on cotton ball. But that would be cruel of me, and I'll tell you why. Because if you will take a cotton ball, you will absorb at least 1 ml to 2 ml of this product into the cotton ball, and that's a waste. So I don't want you to waste your money. I don't want you to waste the product. So I'm telling you, take a Q-tip, the Q-tip that you clean your ears with. This is your product. Nobody else can use this but you. So nobody else touches it. So you take a Q-tip, you dip the Q-tip inside the mandelic acid, and now you apply it on the discoloration that you have, be it your upper lip, be it your chin, be it your cheek, be it your forehead, whatever it is, wherever it is. Whether you are white, whether you're Hispanic, whether you are ethnic, whether you are dark, whether you are African, whatever. You use this. This is the safest way to get rid of your discoloration or to treat your melasma or cloasma. So you use the mandelic acid. After you put the mandelic acid on your skin, you wait for 3 minutes. 3 minutes. After 3 minutes, you take the neutralizing solution that you prepared before, and now you're washing off the mandelic acid. Completely washing it off. After you washed it off, you rinsed it off, rinse your face, take a little washcloth, then tap half dry, and then you apply 2 drops of the HA plus C serum, which is hyaluronic acid with special MAP-C, and then on top of the serum, you apply the HA plus C cream, and you are done. This treatment, if done twice a week and followed by instructions, and the instructions are very clear. You start the first week, you do it twice a week, and you start with 3 minutes. The following week, you go up and you add 1 minute, so now it's 4 minutes. The week after, it's 5 minutes, and so on. Why are we doing it gradually? Because we don't want to shock the skin. We don't want to do it in over a minute and rapid, because in America, everybody wants everything fast. This cannot be done fast. Why? Because we are dealing with human skin. We are dealing with a living organ. And when we are dealing with human skin and we are dealing with discoloration, we have to be very careful, we have to be very patient, and we have to do it slowly and gradually, slowly and gradually. Rome was not built in one day. You did not acquire discoloration overnight. So why do you think that you can expect to get your discoloration rid of overnight? Does not happen. And if anybody tells you, they lie to you. And here is the problem. So many scrupulous people will sell you garbage, will sell you really, really bad stuff. And if you push, they will sell you bleaching agents. And young people want everything fast. And they want everything in a day, in a week. And you will buy bleaching agents. And ladies and gentlemen, when I came to America 40 years ago, the biggest thing in America was that everybody was running to the dentist to take out mercury because it was poison. And they didn't want mercury. People was getting heart attacks and cancer, all kinds of stuff from mercury. But guess what is in a bleaching agent? So a bleaching agent is made out of mercury, ammonia that you put on the floor when you have an oil leak from your car, you drive and you put ammonium to get rid of this, and steroids. These are 3 dangerous chemicals that strip your skin of any protection and strip your skin, remove the skin, and it brings an unnatural hue to your skin because you are burning your skin, because you are removing and you are blocking the tyrosinate that is pushing this melanin to the surface. It's being blocked because you're putting these horrible chemicals on you. And so the melanin, this knows that you are burning here, and this tries to come up. But as long as you are putting the chemicals that cause cancer in the long run, that cause cancer, liver cancer, pancreatic cancer, and skin cancer, and yes, you can die from skin cancers, they cause horrible damage to your skin, but young people think that they are invincible, it will not happen to them. And as long as you use these dangerous chemicals, the dangerous chemicals are blocking the melanin to come to the surface. But melanin is working, it wants to come to the surface, but it cannot come because it's blocked with the mercury, it's blocked with the ammonium, it's blocked with the steroids. And the moment that you stop using the bleaching agents, the melanin that was pushed unnaturally by force down and was not allowed to come to the surface, it explodes. And your skin gets 5 shades darker than what you started with. So this is why I'm telling you that quick fixes are not fixes. That God gave you a gift, and I think our life is a gift. I think our skin is a gift. I think that, largest organ in your body is your skin. You have an obligation to protect it, and it protects you. Your skin protects your whole body, protects everything. So why would you damage it? Why would you burn it? Why would you hurt it? Why would you treat it with respect? Why wouldn't you do the right thing for your skin? Because it's there to protect you, but you have an obligation to protect it too. And when you are buying the Mini Eva Skin Lightening Kit that has the mandelic acid in it, and we talked to those of you who joined us now, and I don't know if somebody joined because I can't see without glasses. Hi, Shelley. Hi, Shelley. If you are joining us now, we are talking about a woman that suffer from hormonal imbalances, from PCOS, from discoloration, and what treatments they can do to get rid of the discoloration. And I was talking about this. I said we have a gift also, and we have a surprise also. So anybody that buys today the kit, whilst I am live, once I go live, c'est la vie. But whilst I am live, when you buy the products that we are talking about, in this case, we are talking about the Mini Eva Skin Lightening Kit, which costs $235, consists of 6 items, which has the crystal microdermabrasion scrub, which has the microneedle roller, the mandelic acid, the neutralizer, the HA plus C serum, and HA plus C cream. That kit, if you purchase the kit today, you will get also a 15 minutes live consultation with me, which normally costs $49, but you will get it, but it's just for today. And the reason that I do this, it's not because I want you to buy this product and say, come on, and I hook you. No, absolutely not. That's not the case. I am way too old, way too many years in my business. No, I'm doing it for one reason only, because I explained this earlier. My home is YouTube. So I have a channel, Eva Taub Skincare, on YouTube for many, many years. So I have a presence there, and people know me there. And people that have problems with PCOS, with hormonal imbalances, with discoloration, with insulin resistance, Hashimoto, Cushing's disease, or a menopausal woman or premenopausal woman, people go to YouTube and people watch my videos because I have 1,300, 1,400 videos, because I talk about the subjects nonstop. But the reason that I am speaking to people on Whatnot, and the reason that I am offering you for duration of the show, a 15-minute free consultation with me, which normally costs $49, is because I checked Whatnot, I looked, and there are so many products. It's a selling app, like Home Shopping Network. It's a selling app, but so many products are being sold on this application that do not work, or they do hurt people that have pigmented skin, that do hurt people that have discoloration, that do hurt people that have melasma, that do hurt the skin people that suffer from hormonal imbalances, because it's a completely different story when you're treating an underlying condition. And because I do this for over 40 years, I am in my Bay Harbor clinic 40 years, ladies and gentlemen, not a day or two. So I happen to know one or two things, but I find it as an obligatory thing on my part to share knowledge that I have and the information that I have about hormonal imbalances. And to those of you who are joining fresh and have not seen me, have not heard me, I said it when I started to talk, that my sharing knowledge and information and my time with you out there is because there is so much misinformation out on women that suffer from PCOS, or women that suffer from endometriosis, from Cushing's disease, from insulin resistance. How do I know? First of all, because I treat thousands of women. But unfortunately, I know way too much and way too well, because I have one child, one daughter. And my daughter suffered for the last 32 years from PCOS. She started at age 14. My daughter is 49. She will be 50 next month. For 32 years, my daughter suffered from PCOS. Then it went to stage 4 endometriosis. My daughter had 19 surgeries. My daughter lost 70% of her organs. My daughter could never have any children. My daughter was hairy from her forehead to her toes. My daughter was 100 and something pounds overweight. My daughter was miserable for the majority of her life because she was in excruciating pain. And when you are in excruciating pain, life looks very miserable. And it is something that as a mother, to the only child that I have, it is very painful to see. It's a very painful thing to experience. And because I went through all the stages and I did all the homework, because she's the white of my eyes, she's my life. And I would do anything. I'll give her my arm, I give her my heart, I give her anything if I could take her pain away, but I couldn't. And I did everything I could, and I did tremendous amount of research. And this is why I made it a point to speak out and to share with women. Because even today, 2026, my daughter's surgery was 7 weeks ago, was a 19th surgery. In America, there is only one endometrial excision surgeon, only one. He's the number one in the world, and he happens to be in Atlanta. He operated on my daughter 14 times. 14 times. He's a God's gift to humanity. He could not change the outcome. My daughter could not have children. But he was alleviating pain from my daughter. Because when you have endometriosis, stage 4 endometriosis, and it attacks your organs, and the pain is so excruciating, so that my daughter was climbing the wall, not enough that she was hairy. And okay, her mother has lasers, her mother lasered her. But that was not the only problem. The pain, the misery, the unwanted hair, the discoloration on the skin, because you have hormonal imbalance, you get discoloration. So I've seen it all. I've been there from day number 1 till today. And as I said, 7 weeks ago was my daughter's 19th surgery. 19th surgery. And when I spoke earlier and I said, some people say, PCOS, let me tell you, when I sat inside a pre-op with my daughter, so just before they rolled her up, they sedated her already, and just before they rolled her up, the operating theater nurse was there. And I spoke to the nurses and I said, yeah, we are not novice to this, unfortunately. I said, this is a 19th surgery. And she looked at me, she said, wow. She said, Mrs. Taub, do you know what the biggest problem is? A part of the suffering. She said, I'm a nurse. She was from New York, and she said, I have PCOS. She said, they don't believe women. They don't believe us. This specific surgeon in Atlanta is a God's given gift to humanity, because he does. And he does the best that he can under the circumstances to alleviate pain. And when you have stage 4 endometriosis, it's worse than cancer, because there is no cure. And when endometriosis attacks, it attacks organ after organ after organ after organ, and all you have to do is constantly go in, cut out the endometriosis, cut out the organ if the organ is already attacked. So this is an ongoing thing, and endometriosis can go to your colon, can go to your bladder, can go anywhere, can go to your lungs, can go to your brain and kill you. People don't understand how complicated endometriosis is. And so because I know, and because I am the number 1 black skincare expert in the United States, the number 1, because I treat dark pigmented skin before I came to America. So I have tremendous amount of expertise in the field. I felt that God gave me this gift. I'm sarcastically, I say gift, that I had one child, and that child suffered for 32 years and still is suffering till today. On my way to the clinic today, my friend from Manhattan called me and she said, how is your daughter? Because she knew she had surgery. It was a huge surgery. And I said, I don't know. And she said, what do you mean? I said, I don't know, because she has pain. And we don't know if the pain is from the surgery or it's the pain is from something else. We don't know. But just so you understand, this is the reason why I'm talking. And this is the reason why I come to this whatnot application, because I see so many people selling so much garbage to people who need my advice, who need my help, who need to know that there are products out there and there are treatments out there that can really help you. And so this is why I was talking about the Mini Eva Skin Lightening Kit for the face. And now I'm going to switch gears and I'm going to talk about another product. So this, by the way, this is $235. Now, if people ask, like, how long will this last? This whole kit can last you 4 or 5 months, because you don't use a lot. And I told you that you shouldn't be using a lot. So let me just see. Okay, okay. I want to talk. Okay, let's just go back. Just a second, guys. Okay, I want to pin this. Okay. So now I want to talk about the melasma, chloasma, and discoloration. Discoloration in women that have real deep discoloration. And if you have really deep discoloration for many, many years, particularly in between your inner thighs or under your armpits, or you really have bad discoloration. And there are a lot of women that come to see me that have discoloration where the face, where they destroy their face and their face is 4 or 5 shades darker. So there is a product that, again, by try and error, I created. This is an ozonated oxygenated serum. This ozonated oxygenated serum I created. I do a lot of research, I do a lot of studies, and I came across information that I put together, and then I tested it. And I have very little of these because these are custom made. I make these ozonated serums, oxygenated ozonated serum, by order, customized, they're freshly made, and it takes me a month to create several jars. So I don't know if there is like 7 jars left or something of this ozonated serum. But what this ozonated serum does, and I'm going to try to show you something that maybe I can show you. Maybe everybody can see. So can you see these white dots that I have here? I will come a little bit closer. So I have like 2 white dots on my upper arm. I think you can see it. Here, okay. So I have these white dots, and I'm not a child. I wasn't born yesterday. And so I had this, this was like 25, it's the size of 25 cents. Size of 25 cents. Angela, hi, Shelley, if I said already, and if not, excuse me. And I created this ozonated serum, and I apply this. I live in South Florida, I live in Miami. So we have basically sun the whole year through. And I have a garden, and I am a big animal lover, and I have a lot of rescue dogs. So every morning, you know, I'm in the garden, I clean the poop, I wash the garden, I water the trees. I'm outside in the morning, I'm active. And so I didn't pay attention if I did it for 2 months, for 2.5 months. But I was putting every day, like on my toilet table, I had the ozone, and I just put a little bit, and voila, I went out. I didn't pay attention to it. And then one day I looked, because you know, there is looking in the mirror. You're just looking if you are properly dressed, if everything is okay, but you're not analyzing yourself. And I definitely don't analyze myself. So, and then one day I looked, I said, wow, it's gone. It was gone. But what happened was, because I kept doing it, the scavenger also took out my pigment. So this product works amazing. It's a scavenger. However, you have to pay attention. You have to pay attention when you use it. You have to be very respectful. This is a very potent product. So women that have underarm discoloration, inner thigh discoloration, knuckle discoloration, ankle discoloration, knee discoloration, bikini discoloration, or very bad discoloration on the face, on the neck, on top of buying the Mini Eva Skin Lightening Kit, if it is the kit for the face or it is the kit for the body, you can buy this oxygenated ozonated serum, and then use it. It comes with instructions. So you use the serum together with the Lightening kit. So now, here is the Lightening kit for the body. So the Lightening kit for the body costs $320. $320. And let me just do this. So I'm trying to show you something by now. And then, okay, here we are, pin. Okay. All right. This is the Mini Eva Skin Lightening Kit for the body. So for any woman, any man that suffers from discoloration, from ingrown hairs, from chafing, if you're in the thighs, if you're chafing, a lot of dark women have very dark knuckles, on their fingers, dark knuckles, because the skin is very dry, and we have a tendency, we work with our hands, and not everybody is protecting their hands with creams and with gloves. So the knuckles get much darker than the hands. That is a wonderful treatment to use the Mini Eva Advanced Skin Lightening Kit together with the ozone serum. So the ozone serum by itself is $150. If you suffer from cloasma, from melasma, which usually comes as a pregnancy mask, everything is hormonal, ladies. Everything is hormonal. But if you suffer from this, from cloasma, from melasma, buying the Mini Eva Skin Lightening Kit, which is $235, and buying the ozonated serum, which is $150, you're going to solve your problem, but not overnight. It will take you maybe 8 months. It will take you maybe a year. Because I just want everybody to know, cloasma and melasma are the hardest things to get rid of. Cloasma and melasma are the hardest thing because they are so deep in the skin, are the hardest thing to get rid of. So I need everybody to understand that when you are treating deep discoloration, which cloasma and melasma is, it's very deep discoloration, it will take time to lighten it. So my recommendation, if you have cloasma, if you have melasma, buy the Mini Eva Skin Lightening Kit for the face, the $235 one, and then buy the ozonated serum. Not everybody needs the ozonated serum. Not everybody. But somebody that has really dark discoloration deep for years, or inner thighs like deep for years, you will benefit very greatly from using the ozonated serum together with the Mini Eva Skin Lightening Kit for the body. The difference between the Mini Eva Skin Lightening Kit for the face and the Mini Eva Skin Lightening Kit for the body is only one. It has 6 items. Both kits have 6 items in it. They have the microdermabrasion scrub. They have the microneedle roller, so I will take it out so you can see. Okay, same thing. It's exactly the same thing as the facial kit. The only difference is, so you have the microdermabrasion scrub, you have the microneedle roller, you have the mandelic acid, you have the neutralizing solution, the powder, you have the HA plus C cream, and the HA plus C serum. So you have all this. The only difference between the two kits is the mandelic acid. So the mandelic acid for the face is 10% with low pH. 10% with low pH. For the body, it's 20%. So that's the difference. Okay. Yeah. Everything else is the same in the kit. So this one is, you can see, one is, this is 20%, this is for the body, and this is 10%. So I'm showing it. 10 and 20, 10 and 20. So the only difference is the strength. The one for the face is 10%. The one for the body from the neck down is 20%. Because your skin on your inner thighs is thicker than the skin around your lips, around your eyes, on your cheeks. The skin on your underarms is thicker, or your elbows, or your knuckles, or your toes, or your ankles, or your tush is thicker than the skin on your face. So for the face, we use the 10%. For the body, we use the 20%. Everything else is exactly the same in both skins. There are no shortcuts. Again, there are no shortcuts. You cannot try to buy one thing without doing the other thing. Because again, please understand, in order for mandelic acid to penetrate in the skin has to be prepared. In order for the product to go in, you have to use microdermabrasion scrub, remove everything that's inside your pores, then remove everything that's on the surface and the dry skin. Then you have to create little micro channels by doing the micro needling, so that the products, when you apply the mandelic acid, will penetrate under the epidermis so that it can do its job. If you just use mandelic acid, it will not work by itself because you didn't go through the steps. The same way, when you brush your teeth, don't you do 5 steps? Don't you need a toothbrush, a toothpaste, a mouthwash, a dental floss, and water to clean your teeth? So you did 5 things. So that's the same thing. You need step by step. You cannot brush your mouth with a dry toothbrush. You cannot only floss your teeth and think your mouth is clean. You cannot only put toothpaste in your mouth and no toothbrush. Doesn't make any sense. But that's the same thing. You cannot do only one thinking, I will make a shortcut. Certain things in life don't work with shortcuts. When it comes to your skin, when it comes to discoloration, it doesn't work in shortcuts. That's number 1. Number 2, I want everybody to understand that the difference between a professional clinical product, which you only can get through me, you can only get it, we are here on Whatnot, you can get it Whatnot, or you get it through my clinics. You can't get it in any store because I create this. And when I created this, I made sure that it should be the best product that I can make that will deliver the best results. And what makes this product potent and different than anything else that you sell or that you buy on the market? I'll tell you what makes this product different than anything else. A little chemistry. So in America, you can say anything as long as you don't make a medical claim, you're fine. So you want to sell glycolic acid, or you want to sell mandelic acid, and you say 100% mandelic acid, 100% glycolic acid. There is nothing farther from reality and from the truth. This is something, and in America you don't have to tell the truth either. There's no requirements in business to be honest. There's no such requirement. So I will give you a little lesson in chemistry so you understand why these products are different, because they're clinical products and I make them and I vouch for them. But here is the biggest difference between products that you buy outside, or you buy from influencers, or you buy that sell you shit. I'll tell you what the difference is. Anybody that knows chemistry, and if you don't know chemistry, I'll give you a quick lesson. So we have something called pH, and we have something called acid, and we have something called alkaline. So water that you drink is alkaline. Soap that you use to wash your body is alkaline. Vinegar is acid. Lemon is acid. Now, a potency of the product is not by the percentage. So I can say there is 100% mandelic acid here. Bullshit. What matters is the pH. So the pH, so acid is measured from 0 to 7. And from 7 to 14, it's alkaline. 7 becomes 0. There's no acid when it's 7. So when they sell you products outside, they can say this is 100% mandelic, 100% glycolic, but the pH of it is 6.5%. So the acidity of the product is barely existent. And that's the difference in a professional product or in a mass marketed product that people sell for $20 or $10, whatever. I don't know, but people sell it. The pH here is very low. In order for the product to work, the pH has to be balanced and the pH has to be low. So the pH in the acid is low, and therefore the acid works. Therefore, there are no shortcuts, guys. My mother told me both cheap is both expensive. This is just reality. I was always told I'd rather have one pair of shoes, but they are good quality shoes, than I buy 10 pair of garbage. It's just cheap. They fall apart. You buy one pair, maybe you spend $500 on a pair of Ferragamo shoes. But they will last you if you take care of them, if you polish them, if you clean them, if you change the heel, if you change the sole. These shoes can last you 15 years. So that's the difference when you buy quality versus when you buy cheap garbage. So this is just like in life. So you buy cheap or you buy something of quality. This brings me to a second subject because we are in March. And this has nothing to do with me. This is nothing to do with me. I'm not selling you anything. But I want you to listen to me very carefully. When I created my glycolic acid, I created also a sunblock. Because we live in Florida and there is sun. And when you are using mandelic acid or glycolic acid or phenol, whatever acid you are using, you should protect yourself with sunblock. And so I created a sunblock, and my sunblock, the percentage of the chemical at the time in the sunblock was 20. And people will come to me and say, Eva, I bought 70, I bought 50, I bought 100. And I said, it's a gimmick. Because there's nothing higher in reality than 20. That's the maximum that you can go in the composition. So it's extremely important to understand that you can make in America a lot of products, and a lot of products, you can say all kinds of things, and it's okay, as long as you don't claim medicinal changes or benefits, it's fine. I want to share something with you because I did a lot of research about this. I personally use mineral makeup foundation. I make mineral makeup for my patients, my clients that come here. But I don't sell it on the market because makeup is not my forte. But when you come for mandelic acid treatment, for lightening treatment, whatever you come, and you're in Miami, it's warm outside, I will put sunblock on you, and I make sunblock for mineral makeup. So I use zinc oxide and zinc dioxide. So I have, this is what I make. Okay, so this is powder, but I don't sell it outside. It's just for my clients who come to Miami or to my Atlanta clinic, they can get it. So this is mineral makeup, but this is 100% sunblock. Why? Because this is made out of zinc oxide and zinc dioxide. So I use this. I put a little bit of this powder every day on my face after I did all my routine, and I put all my serums and my creams. Then I put a little bit of the powder on my hand, and I put my aromatherapy oil, 2 to 3 drops, mix it, and then I have foundation. And then I put it on my face. And I get protected the whole day from the sun because I'm using no chemicals, no sunblock, but I'm using a biological sunblock. And zinc, by nature, is a ultraviolet diverter. It diverts the ultraviolet rays away from you. So it's not sunblock, but because it diverts the ultraviolet rays away from you, it acts as a sunblock. So I'm a big proponent of zinc sunblock. No, I did research and I found this. So this is an Australian company. You can buy it at Target, Walmart, wherever you want. And one of the problems that I encountered, you know, because as I said, I'm the #1 black skincare expert in America, and I treat a lot of dark skin patients in the thousands between Atlanta and between Miami. And one of the big problems was always the zinc. So people that don't have this from me, and then they say, Eva, what should I buy? What should I buy? So I did a lot of research. So this is a blue lizard, and this is actually made, it's an Australian company. But I looked at the ingredients, and so it has zinc oxide and dioxide in it. And even though it is white, even though, okay, look, it's white. It's white. However, when a dark person puts it on the skin and you massage it in, eventually it will get absorbed into the skin and it will not leave a heavy white hue on your face as if you looked, if you bought a zinc sunblock just, you know, at Walmart or something. So, any dark skinned person that is buying the mini Eva skin lightening kit for all purposes protection from the ultraviolet rays. Either you use you can buy, if you can buy the powder of zinc oxide and dioxide outside, perfect, and you mix that with my aromatherapy oil, perfect, and you make a foundation. But if you cannot, then this, for everybody that is dark, you buy this, and this will, look at my hand, so I put it on, look at my hand, and it is absorbed into the skin. So this is the sunblock that I wholeheartedly recommend for people that have pigment in their skin to buy. It's Blue Lizard, Australian sunscreen. Let me read because I can't see without glasses. And it says, #1 pediatrician recommended, a mineral-based sunscreen brand. So it's for children. So if it's good for children, it must be good for you. So this is what I would recommend for people that do the lightening treatments. This is what I would recommend that you buy for yourself to use on your skin, to protect your skin, because ultraviolet rays are very strong, and everybody should have protection, particularly if you are doing the lightening treatment, because you have discoloration. You do not want sun to go and create more discoloration, so you want to use a sunblock on a daily basis. So we covered now, we have the Mini Eva Skin Lightening Kit for the face. That is, so you can go to my homepage and you can see it. That's $235, consists of 6 items. Or we have the Mini Eva Advanced Skin Lightening Kit, which costs $320. The difference also consists of 6 items. The difference is that the lightening kit for the body has a 20% mandelic acid with low pH, and the one for the face for $235 has 10% mandelic acid with low pH. All have the same 6 items. You have a crystal microdermabrasion scrub, you have a microneedle roller, you have mandelic acid, you have the neutralizer, you have the HA plus C serum, HA plus C cream. So you have all these items in there. We also talked about people that have real deep discoloration, or women, white women particularly, and Hispanic women that suffer from pregnancy mask, from cloasma and melasma. And for you, I suggested that you get the ozonated, oxygenated serum, which I had on earlier before, which was $150. And you use it in combination with the Mini Eva Skin Lightening Kit. It comes with instructions. It's a very, very potent product. This is why I took my robe off, to show you guys that I removed that like 25 cents brown spot, and I used it maybe 2 months, I don't know how long exactly, and I got rid of it, and I didn't pay attention. Then I also got rid of my natural pigment. So it's a oxygenated scavenger. The ozonated oxygenated serum costs $150. It should be used together with the Mini Eva Skin Lightening Kit, but only, not everybody needs it. Only women that suffer from melasma, cloasma, because it's very hard to get rid of, and this will help it, or women that have like very dark knuckles, very dark inner thighs, that when the thighs are rubbing, or have really heavy discoloration on their pubis from ingrown hairs or ankles or elbows. So those people that have really, really deep, dark discoloration, few shades, and it's there for years, you should get the Mini Eva Skin Lightening Kit for the body, which is $320, and you should get the oxygenated ozonated serum. The whole thing will last you at least 4 or 5 months, and you might have to replace some items in the process, but you can buy them then individually, whatever you are running out of. This is a clinical treatment. You cannot buy the treatment anywhere else but from me. So unless you come to my clinic, you can buy it, but otherwise you can buy it here on Whatnot. And I said that anybody that buys my products today, hi Janet Warden, you will get an additional gift of 15 minutes consultation with me, live consultation. We will arrange it. So when you buy the kit, we will arrange for a live consultation. If you have questions about your skin, if you have questions about hormonal imbalances, if you have questions related to your discoloration because you suffer from PCOS, you suffer from endometriosis, you suffer from Cushing's disease, insulin resistance, Hashimoto disease, all of these conditions, you will have a 15-minute live consultation with me. We will do it via WhatsApp. My phone number is 305-864-3333. That is 305-864-3333. And I will give you another product there. And I said that I have a gift. I have a surprise gift, so I will tell you what the surprise gift is when I go through the product. So just, glasses. I always pretend that I'm 18, that I can read without glasses, but I can't. So I'm just pretending. Okay, so now we are going to talk. Let me just bring this up. Okay, go back. Excuse me, pin. Okay, I'm back. All right, so now we are talking about this. So anybody that needs a proper maintenance, needs a proper treatment at home, whether you need a proper cleanser, whether you have discoloration, whether you have oily skin, whether you have acne skin, this is a trio of mandelic acid. This is a kit that has mandelic acid cleanser, mandelic acid toner, and mandelic acid moisturizer. So if you have discoloration, if you have oily skin, if you have dull skin, if you have acne, if your teenager has acne, you want to buy this $75 kit. Again, I created this. This kit consists of 3 items. So it has the foaming mandelic acid cleanser, it has the mandelic acid toner, and it has the mandelic acid moisturizer. Costs only $75, the kit. So you can buy all 3 items, the mandelic acid cleanser, the mandelic acid toner, and the mandelic acid moisturizer. Why is this good? So if you have discoloration and you want to treat your skin, then it makes sense that you should clean your skin before. So using the cleanser, using the toner, using the moisturizer, on the days that you are not using the lightening treatment, is the normal process by which to go. And so you are continuing the process of treatment because all 3 items have mandelic acid in them. have mandelic acid in them. So you're continuing the process. So you're cleaning your face. I am telling everybody, cleaning your face is as important as cleaning your teeth. You clean your teeth twice a day, morning and evening, correct? At least. Well, you clean your face morning and evening. So you get up in the morning, you slept, you want to wash your face quickly, use the foaming cleanser quickly. Wash it off, take a cotton washcloth like this. You take a cotton washcloth like this. After you washed with the foaming cleanser, you take the cotton washcloth, you wash your face off, you rinse it, you wipe again. Then you take the mandelic acid toner, a brightener, you put a little bit on a piece of cotton, you wipe your face, and then you put the mandelic acid moisturizer. You take just a little bit, put on your face. And then you put your makeup, you put your sunblock, whatever you do. This kit only costs $75. And if you have oily skin, or you have acne skin, oily or acne skin, mandelic acid not only is wonderful as a treatment to get rid of discoloration, but it's also a microbiome. So if you have acne, the mandelic acid acts as a microbiome and kills the bacteria, on top of everything else. So it kills the bacteria. So it's a wonderful thing if you have a teenager, a son or a daughter, or yourself. You have oily skin, and a lot of people have oily skin. To control it, you get this mandelic acid trio: cleanser, toner, and moisturizer. So you get this trio, and it's only $75. Okay? And then we have one more kit, and I'm going to show you. I learned this today. I didn't know how to do this, so I am doing this today, and I'm going to show you something else. Okay, pin. Okay, and let's go back. All right. And now from the trio cleanser, toner, moisturizer, we are going to the last item that I want to show you. For all of you that don't know me, not people on YouTube, the majority of people know me, or Klapper, people know me, but people on Whatnot, they don't know me. Here is something very interesting. So if you're hesitant and say, should I spend $235? Should I spend $320? I don't know really if the products work. That's a bit of money. So I have an entry point of view. So I have this starter kit, okay? This starter kit consists of 5 items. It will last you for about a month. And this starter kit is good for anybody that is not sure that my products will work and it's worthwhile to spend the money on it. So this starter kit, $75 kit, has a mandelic acid cleanser, has a mandelic acid toner, has a mandelic acid moisturizer, and has mandelic acid, 10% mandelic acid, and a neutralizer. So this is a starter kit for those of you who are hesitant, who are not sure if you should spend the money, or if I'm selling you the Brooklyn Bridge, well, for $75, maybe I'm selling you the Brooklyn Bridge, it's not the end of the world. So you spend $75. So this starter kit is for anybody that is not sure or that wants to buy it as a travel kit, because it is small, so you can travel with it. So it can be actually good as a travel kit when you are going away. Some people, I have a lot of clients, that buy the regular kit, the Minieva Skin Lightening kit, and when they travel, they take this, because you can take, I think, 4 ounces, but these are 2 ounces, so they're smaller. So you can take this as your travel kit, and you have your cleanser, toner, moisturizer, and you have your mandelic acid, so you don't have to stop your routine. So you can buy this. This is $75, and you can use it. It's exactly the same thing like the standard regular size kit, but this is for those of you who either want it as a travel kit or who are not sure and they want to test it before they spend the $235 on the regular size kit. They want to buy this kit. This is for $75. This is available. Again, you cannot buy it anywhere else. You can only buy it from me because I make them and I'm not selling them anywhere else for many, many reasons. But one of the reasons is that I want people to know how to use them. And only if you buy it from me do I know that when you buy it, you get the instructions with it. And that you will follow the instructions, so I hope so. But at least I did my job by giving you the instructions with the products and by you using the products correctly. So that's it. So now let's recap. Let's go over this. Anybody that is buying the Mini Eva Skin Lightening Kit that we showed before, or the Mini Eva Advanced Skin Lightening Kit for the body. Anybody that buys it right now, and we have, I don't know, it's another couple of minutes because then I get off. If you buy it, you will automatically get a 15-minute live consultation with me. If you are in Miami or if you're in Atlanta, sure, you can come to my clinic and we can have a live consultation. But if you're not, we can do it over WhatsApp. My number is 305-864-3333. You get a free live consultation with me, which normally is, I charge $49 for the consultation, but it will be live. It will be free for you if you are buying. And the reason I do it is because I believe that maybe you are hesitant and you do buy the kit, but then you are not sure and you want to talk to me. So by all means, you can buy the kit and you will get a 15-minute free consultation from me. And anybody that is buying the Mini Eva Skin Lightening Kit, the Ozone Serum, or the Mini Eva Advanced Skin Lightening Kit, will get a bottle of the mandelic acid. You will get a bottle of mandelic acid as a free gift. I said that I'm going to give a free gift. So you will get this. This is $25. You will get this in addition to the free consultation for 15 minutes. You will get with the purchase of the Mini Eva Skin Lightening Kit, Mini Eva Advanced Skin Lightening Kit, or with the purchase of the ozonated serum, you will get a mandelic acid toner as a gift from me for today, for now. On the ozonated serum, guys, I don't know how many are left. I don't know how many were purchased, but I think that I said that I only had 10 left, and I think there's only 7 or 6 left now, because those are made to order, because the composition of them, and it takes me a month to make. So if you're ordering them later and I run out of them, it takes me a month to make a new batch. It takes a long time. I have to, there are machines that creating it, and it's saturated with oxygen and ozonated oxygen. It's a process, but it works. It 100% works to lighten discoloration. So anybody has any questions, that's by the way, if there are any questions, let me look. I can gladly answer if there are any questions, if I missed anything. Did anybody ask anything? I don't think anybody asked anything. If I miss, hi Shreve, hi Booby, okay, hi Cheryl. If I miss anybody, I apologize. Okay, and nothing here, and then okay. Sarko, thank you. Hi, honey. Hi. Okay, guys. With that, I will say ciao, ciao. Thank you very much for joining me wherever you are. Good morning, good evening, good afternoon, good night, wherever you are. For me, it will be good night. It's 9:30 Eastern time. So I thank you very much. You have an amazing weekend. And we will see each other again. And again, if you have any questions, 305-864-3333. Or you can DM me. You can message me if you have any questions. I know that a lot of people feel uncomfortable to ask publicly because other people are reading. So you can send me messages privately, and I gladly answer. And until next time, ciao, ciao. Thank you. Ciao, guys. Bye-bye, Eva. Okay, now I have so many phones here. Where do I say? Auf Wiedersehen. I have to say, okay, where do I say goodbye? Okay, end show. Okay, end show. Ciao, ciao. End show. End show. Okay. All right. And here I will say end show. Ciao, guys. Thank you. Okay. End show. No. No. Okay. I have to figure this one out. And bye, guys. Thank you. Ciao.